Hi, my name is Jamie Kana and I live in Potosi, Missouri in Washington County. I am a divorced mother of 5 children ranging in the ages from 5 to 10. I'm a survivor of domestic violence. My children and I stayed in a homeless shelter in Phelps County in order to escape my ex-husband who was incarcerated before being recently released. I work full-time in home health care and also work at an auction every Friday night to earn extra money. I was elected as the Washington County Low-Income Representative for East Missouri Action Agency. I am the secretary of the Mineral Point Lions Club, and I am a chairperson of the Mineral Point Back to School program. I have my associate's degree in business management and my accounting certificate. I am looking for a job in my field. I'm also a part-time student at Jeffco, working towards my bachelor's degree. Between my 2 jobs, I earn about $485 every 2 weeks, which puts my family at the 39% of the federal poverty level. I am in the Medicaid gap and I am uninsured. I have back damage resulting from domestic violence. The only way to fix it is with surgery that I cannot afford. Recently, I've noticed the pain is getting worse and spreading. When I get up in the morning now, my left leg is numb. I also have had severe head trauma and I need to see a neurologist. I don't know what I'll do if it gets worse. I've been told that I could legally apply for disability and I'm only 29 years old. I don't want to be disabled. My kids are all in sports. They're constantly winning medals, making me proud, always in the newspaper. I've got good kids. And I could even be a better mom if I had health care. I work hard, I try hard, and I'm doing everything I can to get by. To me, it's not fair that I can't get help. Medicaid expansion would give me the health care that I need. I've heard that the federal government will pay 100% of the cost through 2016. So Missouri is losing out on a lot of money. I don't understand why Missouri hasn't expanded Medicaid. Being that I am a single mother with 5 children, and not a single one of them in middle school yet, I have a lifetime of memories to make with my babies. I work as hard and as much as I can, but the help I need is beyond my means. One of my biggest fears is being physically confined to a wheelchair before my youngest son graduates high school. We aren't all going to like everything in this bill, but working together to make it right benefits those of us who put our confidence in you guys. If the United States of America can work with other countries to make the world a better place, my hope is that Missouri can work together to get this bill passed, expand Medicaid, and make this state a better place for those who need it. Thank you for your time, and if you have any questions, you can go ahead.
Thank you for your testimony. Thank you for being here today. Are there any questions of this witness? Thank you, ma'am. Thank you for your trip here this morning. Further witnesses regarding House Bills 1901, House Bill 1239, or House Bill 1969?
Good morning.
Good morning.
I'm going to read this because I'm so nervous. My name is Jerry Landon. I live in Sunrise Beach, Camden County, Missouri, with my husband, daughter, and grandson. I work 30 hours per week, and I'm a full-time student pursuing my bachelor's degree to increase my employment options. I'm a proud volunteer with the Special Olympics. My husband and I did foster care for years and adopted and raised 4 children. After decades of employment, my husband has become disabled with rheumatoid arthritis. One of our adult daughters is also disabled. She lives with us, as does our 17-year-old grandson, who we adopted after his parents died tragically. I am the only wage earner and caregiver in our home. And I am uninsured because I am in the Medicaid gap. Our household income is low enough that I can't purchase private insurance, but it's too high to get Medicaid. I am anxious about my health every day. If I get sick, who will take care of my family? If we incur medical bills, will we lose our house? I'm a stage 3 cancer survivor since 2001, but I cannot afford my checkups that I'm supposed to get to make sure my cancer hasn't returned. The last time I saw a doctor, he told me I should take medication for high cholesterol. It costs $38 a month. I can't afford that. Those $38 would have to be taken from our grocery money, and I think our family needs the food more. I am also anxious about my grandson's future. Having lost both of his parents, he has experienced traumatic trauma. With Medicaid, he's been able to see a psychiatrist and get the medication that has stabilized him. One of my greatest fears is what will happen to him after his 19th birthday. Like his father, he struggles with major depression and suicidal thoughts. I cannot let myself think about what will happen to him without health care. For myself, for my grandson, for my family who needs me, I ask that you support Medicaid expansion. Please do not make me and the many, many hard-working and uninsured Missourians like me go any longer without health care. Please expand Medicaid now. Thank you. Do you have any questions?
Ma'am, thank you for your testimony today and for making the drive here
Thank you.
from Lake. Further witnesses? Can I get a show of hands on who's planning to testify? Can I get a show of hands who is not a regular in this building who would like to testify today? Okay. If you're a non-regular, you're going to go first. You're going to go before we go upstairs. So, and I think we can recognize the regulars, so try to squeeze them in. Go right ahead.
Good morning, Mr. Chairman, members of the committee. My name is Keith Crawford. I'm from St. Louis. I work as a construction manager and consultant in the construction industry. Also related to finance, real estate, and insurance as they relate to construction. And I'm here to make the business case for expanding Medicaid, and I appreciate the opportunity that you're allowing me. Although I'm here to make the business case, Medicaid expansion is good for business. Please know that I also support Medicaid expansion out of compassion for less fortunate people. Now, because my background is construction related, I won't try to convince you that I know what I'm talking about. Instead, I want to tell you what people who absolutely do know what they're talking about have to say about this issue. It seems appropriate to start with our own Department of Economic Development. Some of you probably already read their report from last month, but I'm just going to repeat the summary. It says expansion of Medicaid eligibility for adults earning up to 138% of the federal poverty level is expected to inject $17.4 billion in new federal spending into Missouri's economy from 2015 to 2022. Expanding Medicaid coverage would create a total of 23,868 jobs over the 8-year period, $9.9 billion in new wages, $14.6 billion in new gross state product, and $402 million in new state general revenue generated by the year 2022. The expansion would support the same number of jobs currently employed in Missouri's real estate sector. Federal spending of nearly $1.7 billion in the first year of expansion would be on a par with what the University of Missouri system paid its employees in wages and benefits during fiscal year 2013. The effects of Medicaid expansion that I see are varied and many. One is that we have a healthier workforce. You know, we have to compete with the other states for people and as for the quality of the people that we have. Let me read this to you. Poor workforce health costs employers an estimated $576 billion a year. 60% of those costs represent lost productivity and wage replacement expenses driven by short and long-term disability and workers' compensation claims resulting from untreated or undertreated chronic conditions. You know, these are things that they get paid for on the job, but they're not really job related. Employers always bear the financial burden of lost work time, no matter how they finance health care. That's from the International Integrated Benefits Institute, a healthcare think tank out of California. there are a lot of elected officials who are weighing in on this. And one governor wants to ask you, how are you going to feel if you have to go into an emergency room? You'll walk in there and see chair after chair of working poor people, hardworking people, knowing that that's their healthcare system, when we could have given them a better answer. That's what Michigan Governor Snyder has to say about expanding healthcare. Of course, you know other governors who have expanded Medicaid include New Jersey's Chris Christie, Arizona's Jan Brewer, of course, Rick Snyder that I just talked about, Ohio's John Kasich, and Nevada's Brian Sandoval. Another leader has something important to say about expanding Medicare. The normative problem in many programs, including Medicaid, is that they penalize families for getting ahead. When you get over that 100%, you get nothing. The complex web of federal programs and sudden drop-off in benefits create extraordinarily high effective marginal tax rates, which reduce the incentive to work. That's House Committee Chairman Paul Ryan. The effects of expanding Medicaid will enable us to keep down our medical expenses by having preventive care available to people. This is a story from the St. Louis Post-Dispatch about a teacher. She had health care. She was able to get her colon cancer diagnosed and be cured. Had she not, she still had health care. She'd have been treated. The people who don't have Medicaid or some other health care would not have been diagnosed until it was too late, and they would cost our system a lot of money and lose their well-being. When we talk about the kinds of businesses that can benefit from the Medicare expansion, I want to use this company as an example because it's innovative. It's called EnviroPack, and they wouldn't fall under the under 50, so their people now would not qualify for Medicaid. But they've just gotten there. They only have 52 employees. And what they do is innovative and environmentally friendly. They make egg crate like packing for industrial equipment out of recycled paper products. Something like large egg crates. They custom made, custom molded for industrial equipment, and it reduces the amount of packaging and recycles existing paper. That's the kind of company I expect to be attracted to the Northside Regeneration Project that we have in St. Louis. And Missouri's already invested heavily in that with tax credits. And the people, the McKee family, have invested a lot of their money. They have to be able to compete with our neighboring states with a healthy workforce. If we get back to that compassion that I said that I have for the less fortunate, I want to tell you what some other people have to say about it. When you die and get to the meeting with St. Peter, he's probably not going to ask you much about how you did about keeping government small, but he is going to ask you what you did for the poor. You better have a good answer, says Governor John Kasich. We all know what it says on here, in God we trust. In my Bible, in the book of Proverbs, chapter 21, verse 13, it says, whoever shuts their ears to the cry of the poor will also cry out and not be answered. I thank you for allowing me to testify on behalf of this bill, and I would be happy to answer any questions you might have.
Thank you for your testimony. Thank you for taking the time to be here this morning. Further witnesses who are not regulars.
Good morning. I appreciate the opportunity to speak to you guys today. My name is Todd Holtz, and as a volunteer for the National Multiple Sclerosis Society, I would like to go on record in support of House Bill 1901. The National Multiple Sclerosis Society strongly supports Medicaid reform that includes Medicaid expansion to 138% of the federal poverty line. Now, in my written testimony and clearly through verbal and written